Hello, my name is Baylie Houchin and I am a nursing student at the University of Michigan. I am going to present a patient to you. The patient is an 18-year-old unmarried Caucasian female with the initials BF. Her current occupation is as a student. Her temperature was 37 degrees Celsius, blood pressure was 96/68, heart rate was 78 beats per minute, and respiratory rate was 13 breaths per minute. She was not in any pain during the assessment. Chief complaint: abnormal mole and frequent migraines. Mole. The patient's mole was discovered 3 days ago. The mole was discovered on patient's right bicep. Patient reports that mole is itchy and bled after itching, and that she used water to clean it. Patient states that mole does not affect daily activities, is not painful, and denies any associated symptoms. Mole was 4 millimeters in diameter, has irregular borders, and was asymmetric. Patient states that although the mole recently appeared, it has changed in color since she first discovered it. Patient believes that mole is most likely benign. Migraines. Patient reports migraines beginning 4 years ago. She describes her migraines as a throbbing in the front of her head, which later progresses to stabbing pain. Patient rates her pain as an 8 on a scale of 0 to 10. Migraines usually last around 12 to 24 hours, but have lasted days. She states that she usually has migraines once a week. Patient believes that stress and lack of sleep aggravates her symptoms. Patient takes 600 milligrams of Motrin to alleviate pain and has found that taking naps also alleviates pain. Patient reports that the migraines prevent her from getting out of bed until the pain ceases. Migraines prevent her from doing all daily activities. Patient reports nausea, dizziness, and blurry vision during migraine. Health history. Patient reports frequent migraines. Patient has kidney disease and has severe scarring on both kidneys. Patient has had 7 moles removed and has had multiple kidney infections. Patient has a history of childhood seizures. Patient also reports having experienced several anxiety attacks and believes herself to have had undiagnosed depression. Patient is up to date on vaccinations. Patient denies any allergies or reactions to drugs. Hospitalizations and surgery. Removal of extraurethra in 2001. Removal of 7 benign moles. Tonsillectomy in 2005. Patient reports having been hospitalized roughly 40 times throughout her lifetime. Last hospitalization was on February 5th, 2017 because of a migraine. Medications. Patient reports taking 100 milligrams of minocycline twice a day for acne, 20 micrograms of Junel once a month for 21 days a month as birth control, 100 milligrams once a day of magnesium to help prevent migraines, and 50 milligrams of sumatriptan when her migraine pain is unbearable. Functional assessment. Patient reports drinking alcohol about once a month, denies drug use, reports exercising for 2 hours 3 to 5 times a week, reports getting an average of 8 hours of sleep every night. Patient says eating habits have changed drastically in the last 6 months due to moving to college. Reports trying to eat fruit and vegetables every day, but is often too busy to eat balanced meals. Patient denies any caffeine intake. Patient reports making use of safety devices such as seatbelts whenever they are available. Psychosocial data. Patient reports that her parents are divorced, but that her mother and 4 siblings provide her with support. Patient also reports support from friends and a boyfriend. She reports many perceived stressors, including schoolwork and a stressful living environment. Patient lives in a scholarship house with 60 other students and shares a room with 2 other girls. Patient reports living in an environment with recreational alcohol and drug use and often conflicts. Patient does not currently practice any religion, but states that she would like to explore her spirituality. Patient is a freshman in college, specifically the nursing school. Patient reports that she uses sleep and talking to friends as coping mechanisms. Patient reports yearly checkups with a primary care provider in addition to her multiple hospitalizations. Family history. Mother currently has cervical cancer and Sjogren's syndrome. Father is an alcoholic and had a non-fatal brain aneurysm. Paternal grandmother died from melanoma. Paternal grandfather was an alcoholic and died from liver failure. All siblings have kidney disease. Review of symptoms. Given the patient's chief complaints and family histories, an integumentary and neurological review of systems was conducted. Integumentary. Patient reports no new dryness, rashes, or redness. Reports a new mole on right bicep, which she is concerned may be melanoma. Patient reports spending up to 8 hours a day in the sun throughout the summer and reports that she occasionally does not wear sunscreen. Patient reports dryness on back of arms and legs, but states that this is normal for the season. Patient reports regularly visiting a dermatologist to assess any new skin changes and new growths. Integumentary physical assessment. No flaking or lesions on scalp. Hair on scalp and body is distributed evenly, has a normal pattern of growth, is of a normal color for patient's ethnicity and is soft. Skin is clean, odor-free, peach-colored, and smooth. Patient has no abnormal perspiration and body odor. There are no lesions on upper or lower extremities, aside from mole on right bicep. Patient has no tenting when turgor is assessed and is cool to the touch. Patient has no edema on any extremities. Patient's nails are clean, pink, and oval-shaped. All nails are attached and are of appropriate contour and thickness. Patient's capillary refill on fingers and toes is less than 2 seconds. Patient's mole is dark brown, asymmetrical, and 4 millimeters with irregular borders. Neurological review of systems. Patient reports no numbness, tingling, or burning. Patient denies recent losses of consciousness. Patient reports experiencing seizures as a child but has not had one for 15 years. Patient denies concerns about memory but does report impaired concentration during migraines. Patient denies insomnia, tremors, loss of balance, and difficulties with speech. Patient reports experiencing blurry vision and dizziness during migraines. Patient reports that her anxiety occasionally interferes with her daily activities, but she denies having frequent anxiety attacks. Patient reports experiencing mild depressive symptoms 3 years ago, but denies experiencing any symptoms recently. Patient reports suffering a mild concussion 3 years ago. Neurological physical assessment. Patient is well-groomed, clean, and appropriately attired for season and setting. Facial expressions correspond to the content and topics of discussion, speech is clear and normal-paced, and vocabulary is appropriate for age and educational level. Patient is oriented to person, place, and time, can respond to directions and questions, and shows evidence of intact short and long-term memory. Patient shows capability of abstract thought and ability to perform calculations. Patient's gait is smooth and coordinated and has a negative Romberg test. Patient's fine motor movements on upper and lower extremities are smooth and coordinated. Patient is able to distinguish between soft, sharp, and dull sensations on both upper and lower extremities. Patient is able to identify pain and vibration sensations on all extremities. Patient is able to identify objects through touch and is able to discriminate between place and points on the body, meaning her cortical and discriminatory sensations are intact. Patient also displays intact proprioceptive senses. All pathological reflexes are absent and there is no ankle clonus. Pertinent systems. Pertinent system number 1, abdominal. According to Dr. Swanson from Mayo Clinic, printed in January of 2014, it is important to assess the abdomen and GI tract as well when evaluating migraines. Because migraines can cause nausea and vomiting, as they do in this patient, it is essential to assess the gastrointestinal as well as the neurological components of migraines. The article titled, Migraines and Gastrointestinal Problems, Is There a Link? From Mayo Clinic states that people who regularly experience problematic gastrointestinal symptoms have a higher prevalence of headaches than those who don't experience problematic gastrointestinal symptoms. Therefore, an assessment of the abdomen should also be performed on a patient who experiences migraines. Pertinent system number 2, head, eyes, ears, nose, and throat. According to Dr. Gupta from Family Medicine Reference, printed in October of 2015, it is also important to assess the head, eyes, ears, neck, and throat. Some migraines are due to vision problems, therefore, head, eyes, ears, neck, and throat should be assessed to rule out those causes. The article states, migraine in ER states that the head, eyes, ears, nose, and throat should be assessed to rule out any alternative diagnoses and any possible causes for migraines. Thank you for listening.